one's dog should be an enjoyable time, but maladaptive behaviors such as pulling on the leash, attempting to chase smaller animals, or a lack of focus on the handler can significantly impact this time for both dog and handler. Safety and ensuring that neither dog nor handler is injured is of utmost importance when walking. In this study, I looked at the effectiveness of verbal cues on the maladaptive behaviors while walking a dog. Ella, a 16-month-old pit bull terrier mix, and her handler worked to decrease the amount of time it took Ella to walk past a specific problem area on the path they use, as well as decrease the tension on Ella's leash while walking. In effort to decrease maladaptive behaviors, an intervention using the verbal cues look and let's walk was conducted using an AB-AB research design. Baseline data was collected for 5 consecutive days during a 3-mile walk. Upon reaching the problem area, Ella's handler would note tension of her leash and begin a timer. Once past the problem area, the timer was stopped. Initial baseline data demonstrated significant maladaptive behaviors, causing very tight tension on Ella's leash and an average time of 48 seconds to walk past the area. Intervention data was collected for 5 consecutive days also. Upon reaching the problem area, Ella's handler gave her the verbal cue look, provided a training treat, and then another verbal cue, let's walk. The timer was started following the let's walk verbal cue and stopped once past the problem area. Baseline and intervention data were collected again, each for 5 consecutive days. Final intervention data demonstrates both a decrease in duration of time to an average of 36 seconds and a maintained normal loose leash on 4 out of 5 walking trials. Training treats were decreased each day during intervention, and upon completion of data collection, Ella was only receiving half of a treat at the start and half of a treat at the end of the problem area. Verbal cues do show to have an effect on decreasing maladaptive behaviors during walking. Future studies would benefit from completing a preference assessment prior to starting to determine if there is a more reinforcing item besides training treats. In future studies, I believe it would be beneficial to conduct baseline and intervention trials in various areas to determine generalization of this skill.